Hi, how are you? This video highlights the use of PrEPmate for patients and providers and showcases how the platform features are used to achieve short-term and long-term benefits. Pre-exposure prophylaxis, or PrEP, is a medicine a person takes to prevent getting HIV. PrEP is highly effective when taken as prescribed and can reduce the risk of getting HIV from sex by about 99%. PrEP can be a cost-effective method to prevent HIV infection when used by populations that are highly exposed to HIV, but challenges remain to accessing PrEP and staying on it, including knowledge and awareness of PrEP, self-perception of HIV risk, stigma from providers, family, partners, and friends, and access to PrEP, including covering associated costs of PrEP care. PrEPmate helps providers and patients communicate through two-way short message services, or SMS, a trusted channel that's discreet and easy to use. Interactive texts allow patients to ask questions as they arise, ensuring timely access to information. There's no need to download an app, no Wi-Fi or data requirements, and any mobile phone supports SMS messaging. The CDC has recognized PrEPmate as an evidence-based intervention that supports patients to have better adherence and retention for PrEP. Patients enroll using their mobile phone number, and once enrolled, the platform sends them a welcome message to consent to the program with the first check-in message that connects them to their healthcare team. Patients save the number in their contact list. Content was developed using a community-centered design process, ensuring that issues such as stigma, access challenges, and knowledge gaps would be addressed through inclusive and meaningful communication. Patients can expect messages and reminders to be personalized, as PrEPmate does not use chatbots to communicate. By connecting to a known provider, patients are empowered to be proactive, reducing the risk of missed appointments and losses to follow-up. The enrollment process is simple. The healthcare provider and patient have a face-to-face conversation, and the healthcare provider asks the patient for their name, mobile phone number, and enrolls them. Welltel's original research showed that a simple check-in such as a "How are you?" had an impact on positive behavior change for patients. Research has demonstrated the value of the SMS check-in model for different clinical uses and conditions, including comprehensive HIV services, testing, STI treatment, immunizations, pandemic management, family planning, and more. Topical messages designed during the EPIC study are fun reminders that help patients take PrEP medication at their preferred time each day. Pill reminders during the first few weeks of starting treatment help build a routine for taking PrEP, and patients can opt out or change frequency at any time. Topical messages include categories such as fun facts, sex facts, transgender information, LGBTQ facts, affirmations, etc. in both English and Spanish. Here are a few examples. Butterflies taste with their hind feet. Let's move our feet and take our pill for the day. Affirmation of the day. I am the architect of my life. I build its foundation and choose its contents. Time for your pill of the day. Or in Spanish, su verdadero poder y valor no tiene nada que ver con la validación de desconocidos. Clinical staff can use the platform in one training session, while additional training is possible to integrate into clinical workflows. When providers receive their username and password, they receive a message to consent to receiving alerts, which is necessary to use the platform. They are then able to log in from any device and will land on the communications dashboard, showing all incoming and outgoing messages. PrEPmate sends patients automated check-in messages at a frequency selected by the clinic, most often weekly or monthly for PrEP. As patients respond to their check-ins, the system categorizes incoming messages as red, yellow, or green based on the need for follow-up. Red indicates a priority follow-up. Research showed that approximately 3 to 10% of patients required follow-up based on the check-in message, and those that did not respond still valued the program, knowing that their clinical team was just a text message away. Providers can set automated SMS appointment reminders months in advance, reducing patient no-show rates and promoting timely completion for blood work and medication refills. This helps to reduce the need for phone trees, playing tag with voicemail, or being placed on hold. As an example, an automated reminder is set at the very first appointment and goes to the patient every 3 months, stating, "Remember to pick up your refill this week. Please let us know if anything has changed." Most programs use PrEPmate as a standalone tool for communication, although integrations with electronic medical records are possible. An integrated feature set improves efficiencies and capacity, allowing one provider to care for more patients effectively. PrEPmate allows providers to perform multiple functions from a single platform, such as launch to voice or video when needed, exchange photos and documents, schedule appointments, and communicate with referring organizations. PrEPmate is a solution for health organizations that want to optimize comprehensive HIV care delivery. Current clients include health departments, federally qualified health centers, community-based organizations, clinics, and doctors' offices. PrEPmate provides an effective, scalable solution that aligns with the goals of the U.S. government's Initiative for Ending the HIV Epidemic. Focused on strengthening relationships between clinical teams and their patients, PrEPmate supports a continuity of care that navigates patients along their healthcare journey. For more information, visit www.welltelhealth.com/PrEPmate or email info@welltel.org and put PrEPmate inquiry in the subject line.